Hi, so thank you, Maria, for coming to talk to us about your new study. So it's looking at patterns of benzodiazepine and Z drug prescriptions in patients who are, so it's older adults in psychiatric units in Switzerland. And I was just wondering if you can first tell us a bit about the motivation for doing this study, like why you thought this was something that needed to be looked at.
Mhm. So I first started being interested in the subject when I was working in a rehabilitation clinic with older adults.
Hmm.
And I realized that most of them had at least one benzodiazepine receptor agonist, so either a benzodiazepine or a Z drug. And they had that either on a daily basis, so a medication that they were taking every day, or as a pro rata treatment, so something that they could ask for if they needed it. And I saw that like a lot of them had pro-rata treatment for like sleep problems. So if they complained about sleep, we would give them this medication. And I was very surprised because we were working with a especially vulnerable population. They were older patients. They were hospitalized because they had broken a bone or something like that, and so another fall or drowsiness could be very problematic for them.
Yeah.
And then I started like researching a little bit the subject, and I realized that there were not a lot of studies about this subject. There was like a few information, especially about strategies that had been implemented to try to taper down these medications. But I realized that I didn't have like a picture of what the problem was. And then when I began working in psychogeriatrics, I realized that the problem was there too, with people that were even more vulnerable because in top of what I just said, they also had like psychiatric comorbidities, including dementia. And it was then that I asked my bosses if they were okay if I did like a research project about that, and they said that yes, that it was very necessary and that I could go along with it.
Yeah, absolutely. It's incredible how often we come across these situations where, we realize we don't actually have a good sort of understanding of what's going on in sort of like clinical settings. So then
Mm.
can you tell us what you did find?
Yes, so well, the main finding was that one out of three patients had one of these molecules, so either benzodiazepines or jet drugs, at the beginning of the hospitalization. And at least one out of five of them had them at the end of the hospitalization.
Mhm.
So, of course, I was interested in the absolute terms, so what I just told you, but I was also interested in the relative terms, because for me it's very different if you have, I don't know, like diazepam 3 times a day in high doses, or if you just take it once a day in a very small dose. So I also studied that part, and I saw a reduction, an important reduction, relative reduction of 78%. Both in relative terms and in absolute terms, there was a reduction, and it was a like a good surprise, so
Yeah,
to say.
yeah. No,
And
I was really surprised to read that. I guess what I was interested in, it may not be something you're able to tell from this work now, is was that also alongside a reduction in sort of insomnia symptoms or sleep problems, or are we not sort of able to see that yet?
that would have been very interesting to find out. But unfortunately, my study couldn't look at that because it was a retrospective observational study, and I was only looking at hospital records.
Yeah.
And unfortunately, not even insomnia disorder is systematically documented.
Mm.
Those. And like sleep quality is unfortunately not documented at all. So uh, I only had like this vague information, but I don't know what happened clinically, sort of
Yeah.
thing.
Yeah. No, that's really interesting. So I guess then my final question is sort of what is the next step? Like what do you think this research can be used to tell us about the clinical setting and also more generally, kind of do you think we would expect to see something similar in different populations? Like do you think it's a general clinical practice to try and reduce these types of medications being given in hospital at least?
Yes, so I will start
Sorry,
answering
yeah,
you
there
this.
was a lot of questions.
I think that if we looked at other clinical settings, we would discover that it happens in almost all of them. Maybe, I hope, maybe not in pediatrics, but I think that in general hospitals and like in nursing homes, it is a problem that exists. And then, of course, it can be also considered a public health problem. So it would be interesting not only for the psychiatric geriatric population, but like also for the other populations. And well, of course, it's an observational study, so we cannot jump into conclusions. But what my study shows, I think, is at least that we need to study more. We need more studies about the subject, and especially more studies in real life patients, because unfortunately, these patients, so patients with dementia, with a lot of psychiatric and physical comorbidities, are usually rejected from clinical trials. And so we don't have a lot of information about them, but they are the real life patients. Like most of the patients have this comorbidity. So it would be interesting to try and include them more often. And like I hope that it will at least make people reflect on what we're doing in the hospitals and try to implement strategies to taper down this prescription. And I know that there have been now new strategies that are being implemented in psychiatric care facilities with CBTI, for instance, so cognitive behavioral therapy for insomnia. And it would be interesting to see if we could implement those in psychogeriatric care. But of course, we would need to adapt them. So, for instance, instead of targeting the patient alone, we should target probably the patient, the carers, so the family or the people that are around them, and the teams, the hospital teams, because probably they won't be able to do it alone because of their limitations.
Yeah. No, that's really interesting. Well, thank you so much, and good luck for your future work.
Thank you very much.